for our public health nurses and our MCH tribal partners. As a reminder, as you think of questions, put them in the chat box and we'll address them at the end of the presentation. This morning is our 13th and our last of our scheduled web-based training sessions. Today we will cover healthcare transition for young adults. We're pleased to have Rachel Barber, our MCH Youth and Young Adult Health Program Manager, presenting for us this morning. And along with Rachel will be the three benefits and eligibility specialists, Shelly Gonzalez, Paula Ray, and myself, Vicki Garcia. So we'll turn it over to Rachel to begin. Thanks.
All right, good morning. We're going to go ahead and get started with the Children's Special Health Program, Transition to Adult Health Care Services. All right, we're going to cover 3 learning objectives: to identify the meaning of healthcare transition, to identify the need of healthcare transition, and to talk about the implementation of the new tools that are designed to educate CSH families and healthcare transition. All right, what is transitional healthcare? Transitional healthcare is the purposeful, planned movement of adolescents and young adults with chronic physical and medical conditions from a child-centered to an adult-oriented healthcare system. Bright Futures says that a successful transition from pediatric to adult-oriented healthcare depends on youth acquiring disease management skills, except for youth who lack the decisional capacity to guide their own healthcare and are under legal guardianship. A quote from The New Adolescent says, "Emerging young adults often have the lowest perception of risk and the least access to care. Overall, emerging young adults have the highest rates of motor vehicle injury and death, homicide, mental health problems, STIs, and substance abuse. They also have the lowest rates of health insurance coverage." They say, in short, emerging young adults are adrift in a perfect storm of health risks. So we're going to talk about the changing trends for children and youth with special healthcare needs. More than 90% of chronically ill children survive past their 20th birthday. For example, in the 1970s, 33% of spina bifida patients survived beyond age 20. 30 years later, in the 2000s, more than 80% do. Another example projected that individuals with cystic fibrosis born in the 1990s will live until their 40s. With this current birth cohort will live until their 50s. 500,000 children with special healthcare needs turn 18 every year, and therefore most of them reach the age of 21, hence the need for healthcare transition. Now we'll look at a few statistics. National Performance Measure 12. It was measured that the majority of Wyoming parents of adolescents with special healthcare needs reported their child did not get the services necessary for transition to adult care. So you see on the side where it says 82%. Another one about time alone, we have 68%, which is about 2/3 of Wyoming parents reported that their adolescent did not have a chance to speak with a healthcare provider privately, which is without another adult in the room at their last preventive checkup. As far as the changing health trends, almost half, which is 40%, as you see to the side, of Wyoming parents said that their child's doctor did not actively work with them to gain skills to manage their health and healthcare and to understand the changes in healthcare that can happen at age 18. Almost half of Wyoming parents said they do not know how their adolescent will be insured when they become an adult, and they have not discussed insurance coverage with their child's doctor. As you see, that's 45%. And then we have 89%, which is the majority of Wyoming parents, said that their child's doctor did not discuss the shift to providers who treat adults if that information was needed. So there are 6 core elements to healthcare transition. We have transition policy, transition tracking and monitoring, transition readiness, transition planning, transfer to care, and transfer completion. And CSH will be addressing a third element, transition readiness. Implementation of this initiative will start with the January 2019 annual updates. So standards for systems of care for children and youth with special healthcare needs says that transition readiness can be obtained by utilizing a standardized scorable tool to determine youth understanding of self-care and use of healthcare, initially done with youth and caregiver at age 14. So as you see here, there are 3 health transition facts regarding what should be considered. The role of the parent is going to change from being their advocate to now being their ally. The young person needs to learn how to speak on their own behalf. There are 3 things to tell the young person to consider. Know your health history, always carry your insurance card, and know your body well enough that when something is not going well, you know who to call. All right, so on the screen now you'll see examples of 2 documents for the transition readiness assessment. One is for the youth and parent, one is for the youth and the other is for the parent and caregiver. Using an evidence-based approach, we adopted the GOT Transitions tool for assessing transition readiness to be taken by the youth and the parent or caregiver at the time of their annual update. As previously mentioned, implementation of this initiative will start with the January 2019 annual updates. January updates completed before January will also require these assessment forms. CSH will include both assessment forms with their notice of the annual renewal with the hopes that the youth and the parent or caregiver will complete it prior to meeting with their public health nurse. The public health nurse reviews and provides guidance from the completed assessment forms with the youth and the parent or caregiver during the CSH annual renewal visit. The completed forms are sent to CSH with the client's annual renewal paperwork. A copy of this form will be kept in the PHN's chart. These additional forms are required for renewal. PHN will compare previous year's assessment results each preceding year as part of the care plan. Data will be gathered from these forms with help from our MCH EFI. These assessment forms are also available in Spanish and for those with intellectual disabilities. We are providing documents broken out by early, middle, and late adolescents. Use these talking points to develop your conversation while providing guidance upon completion of the assessment forms. This slide and the next 2 slides only show a portion of the talking point documents. So as you see here, we have the early adolescence talking points. These are given at age 14. And one of the main points on this slide says that the health behaviors formed at this time, which is age 14, are likely to continue. So it's very important that we talk about these things. Middle adolescence, which is 15 to 17. This is another example of the document that is uploaded, and it asks questions about, can the adolescent, for example, explain their medical condition, including their medications, and other examples. And it also has examples for, is the parent or caregiver, are they encouraging their adolescent to build the skills to manage their own health care, including when to take and obtain their medications. And the last example we have on the talking points is for the late adolescents, which is ages 18 and 19. Again, you have examples to speak with the adolescent So does the adolescent know what healthcare coverage they have? And then an example from the parent or caregiver is, does the parent or caregiver express questions or concerns about their adolescent managing their health once an adult? So this is a slide about the transition resources, which will be given at all transition assessments. So you have a few links here. You have information about guardianship and also information about health insurance with the various phone numbers and websites for you to go to. All right, this timeline is general information of a quick synopsis of transition steps needed that are arranged by the early, middle, and late adolescents. So as you see, you have ages 14, and then you have the middle, ages 15 to 17, and at the bottom, you can barely see it, but you have age 18 and 19, which is one of the documents that has been uploaded. All right, here, this is a guided talking points again for the youth and for the caregiver to start the conversation with their primary care provider. So you have on the left-hand side, the one for the youth and the young adults, and on the right-hand side, the handout, which will be for the parents. And it asks various questions about things to consider during the adolescent years, and then things to consider before making your first appointment with your new adult doctor. This form, the turning 18, what it means, it gives general information highlighting the next steps in their transition. And you'll see it says there, what does it mean? It gives you a bit of information and then things to know, and you'll see the other points in the document. The next document we have is the portable medical summary, which is given at age 18. The PHN will provide this form to the youth for completion at their primary care provider's office. This form can be used when transitioning to a new provider. And so it includes information about their medical history, also their insurance. You want to also make sure that you provide additional information to the new provider regarding certain fears or things that make the patient, the adolescent, uncomfortable. So for example, if you have an adolescent who does not like white coats, that should be something included in this document so that the new primary care provider knows this information when they first meet with them. All right, next we have the transition wheel. These are available for the PHN to distribute to anyone. The wheel addresses ages 10 to 26, and CSH will mail a supply to each PHN office. We have many of them, so we can send you as many as you want. Just let us know and we'll be happy to provide that information for you. All right, which way do I go? This document is distributed by CSH as an attachment with their letter sent when turning 18. This form provides general information about obtaining healthcare coverage, steps in selecting a new provider, and where to learn about guardianship. The FAQ Adolescent Well Visit document is distributed by CSH as an attachment with their well visit appointment letter starting at age 14. So as you see there, this is a guide for the families. It has what exactly is a well visit, what happens at a well visit, and various other questions and information that is very valuable for the families to know. Okay, so just to recap a bit, the transition process regarding the transition readiness assessment form. So first we have that the readiness assessment form will be used starting at age 14 to age 18. This form will be mailed to the family by CSH with their annual update notice. Youth and parent or caregiver will complete the TRA forms, which are the transition readiness forms, prior to meeting with the PHN to complete their CSH annual renewal. If the TRA forms are not completed prior to the meeting, they will need to be completed at the time of their renewal. PHN reviews and provides guidance related to issues that arose from the completed TRA forms with the youth and the parent or caregiver during their CSH annual renewal visit. PHN sends completed TRA forms to CSH with the client's annual renewal paperwork and keeps a copy in their PHN chart. PHN will compare previous year's TRA results with the subsequent years as part of the plan of care. CSH benefits and eligibility specialists will enter results from completed TRA forms. MCH EPI will assess the data for knowledge or skills gaps, and we may have future resources to address the identified gaps. All right, so we have here on this slide the transition process, specifically regarding the PHN document distribution. So as you see, at every transition assessment, you will do the healthcare transition timeline, which is uploaded on the intranet, and we also have beside each document the identification number. So that way, if you need any additional resources or information about that, we can easily access them for you. Until what happens at age 14. So you give them questions to ask your doctor about transitioning to adult care. And then at 18, or about to turn 18, you give them the medical summary and the turning 18, what it means for you. All right, and then we have a slide here with additional resources, resources from family to family, from guide transition, protection and advocacy, a guide for guardians, and then the guardianship handbook. So we're just going to take a moment and show you an example of the family to family resource there. So this is the page that will come up when you enter in the link. And as you scroll down, you will see all the questions. There's an outline there with questions 1 to question 14. And each question has an associated video that actually explains and provides more details with that question. So for example, the very first one is, what is healthcare transition? There's a small video that may be about 2 minutes long that talks about exactly what that is. And this was a video done by a 21-year-old who has experienced it and wanted to provide additional information. All right, so this next slide is just contact information. You have our CSH benefits and eligibility specialists, Vicki, Shelley, and Paula, who will be happy to answer any questions or provide you with any additional information. We've also provided the link for the PHN intranet CSH page where all of the documents have been uploaded. And now it is time for questions.
I'm not seeing any questions in the chat box. If you have questions, please add them, or you can unmute your line and ask. All of the documents and the presentation has been put into the PHN internet site, and then we'll put together a packet and mail those out to the public health nursing offices and our tribal partners. We'll wait just a little bit and see if we have any questions to come up. So as we mentioned, today is the last of our presentations, and all of them have been put on Y-Train, so you can access them if the public health nurse has missed them or if we have a new nurse. And all of the attachments and presentations are also on the PHN internet page. If I'm not seeing any.
There's a question from Kim.
Oh, question from Kim? Okay. So we have a question for the guardianship and advocacy. Is it the same for Native American kids? Kim, I'm not sure. I would assume it would be.
Yeah.
I gather it's a statewide resource, but
Yeah.
We can certainly check into that for you, Kim. But I think we're all in agreement that it likely serves all kids in the state of Wyoming.
Thanks for that question, Kim.
And since we do have a lot of time left, I would encourage if you have questions, because this is something new, and any of your questions will be logged in the recording, so it will benefit others that view this in the future. So we'll give you a few more minutes to think of questions. I wanted to provide a little bit more about the why behind this project. Rachel did a really good job explaining why transition is important, especially given the changing trends of our CSH population nationwide. So kids are surviving longer with some of those more severe conditions that used to have shorter lifespans. So that's certainly one reason why this is important. The other reason is that, as you all are probably aware, we receive federal funding for our maternal and child health work, and we select priorities every 5 years. And one of the top priorities for the adolescent and CSH population is related to transition. So Rachel showed some important data. One of the pieces of data she showed was a national performance measure. So I just wanted to highlight that national performance measure around transition services is a measure that all states have the option of reporting to the federal government and to report annually on our progress. So it's a data point that we're going to track annually and hope to see through some of our efforts and improvement on that measure, so that we hope to see that parents and youth are feeling more ready for those transition years and that their health outcomes are better, having had those transition discussions early and often. So another why, I also just wanted to acknowledge that this is a new process. So we really appreciate and welcome your feedback as you're implementing this in your communities beginning in the new year. And we hope today's presentation is just the start of a dialogue on how this can work best for you. So I will stop there and see if you do have any more questions.
Kim asked if we could repeat the answer on the guardianship for the Native American kids. Kim, we're guessing it's a statewide organization, and they should also serve the Native American kids. So in that, Danielle said we were asking for your feedback on the forms in that. We haven't translated some of the handouts in Spanish yet, and we're kind of waiting to do that after we get some feedback. But the transition assessment, the readiness documents, the general for the parent and the youth, those two are translated in Spanish now.
We're good.
Yep. With there not being any more questions, we appreciate your attendance, and thanks, Rachel, for presenting on transition healthcare for the young adults. Thank you.
Thank you, everyone.